Hello and welcome back to my YouTube channel Listen and Learn Nursing. In this YouTube channel, I mainly discuss the topics related to the nursing and the medical fields, and for the students who want to present their topic in clinicals to get good marks in exam by writing their answer systematically. This video contains topics related to shock like definition, management, stages, classification, then the proper description of hypovolemic shock. What is hypovolemic shock? What are the pathophysiology of hypovolemic shock? So first of all, in topic presentation, you have to define what is shock. A clinical syndrome that results from inadequate tissue perfusion, creating an imbalance between the delivery of and requirements for oxygen and nutrients that support cellular function. So this is the definition. Then after definition, you can depict this picture which shows how shock affect our organs, and lastly it leads to the multi-organ dysfunction syndrome. Next, pathophysiology. How our body responds to the shock. First of all, the normal cell, and after shock that normal cell get more permeable for the electrolytes and fluids, so it cause damage to the cell organelles. Next is the stages: initial stage, compensatory stage, progressive stage and irreversible stage. These all stages will be discussed one by one. In initial stage, there will be no symptoms of shock and the patient will be asymptomatically, and this is a very important and complex point to be noted. Next, compensatory stage. In compensatory state, because of the decreased tissue perfusion, because of the decreased oxygen, our body compensate by increasing heart rate, by increasing respiratory rate, and by stimulation of sympathetic nervous system, by stimulation of renin-angiotensin system. So third is the progressive stage. So it occurs when our compensatory mechanism become ineffective. Important key point in this is pale, cool and clammy skin. Next, the classification: hypovolemic, cardiogenic, distributive, and that distributive is divided into septic shock, neurogenic shock, anaphylactic shock. So let's begin with the hypovolemic shock. The word already hypo mean hypotension, low blood volume, low intravascular volume. The clinical manifestation is the rapid, irregular, thready pulse, the urine output less than 20 ml per hour, hypotension, tachycardia, low central venous pressure. Normally the central venous pressure is 2 to 6 mm of Hg, so less than 2 it means the hypovolemia. Risk factor, or it is also a causes: external, that is fluid losses; internal, that is fluid shift. So you can see in that picture how that external internal factor affect. Next is the pathophysiology of the hypovolemic shock. Decreased intravascular volume cause decreased venous return, and it cause decreased stroke volume. So decreased stroke volume cause decreased cardiac output. Lastly, decreased tissue perfusion. Next is the general management. In general management, it includes fluid replacement, vasoactive drugs, nutritional supports. In fluid replacement, you can use the RL, that is ringer lactate, normal saline. First of all, we have to start with the normal fluids. Then we can shift to the colloids that include blood transfusion or any albumin and dextran. And the most important nursing point is the Trendelenburg position. We cannot give the high Fowler or the Fowler position, because it also leads to the hypotension. So position is the most important point. This was all about shock.